Civil War Medicine by Sean Cervenka. The Civil War, the deadliest war in American history, tens of thousands being wounded and hundreds of thousands being killed. Those wounded didn't have much of a chance at the beginning, but towards the end of the war, doctors and hospitals got much better. Medicine saved and killed so many soldiers, making it the biggest impact on the Civil War. At the beginning of the Civil War, medicine was very bad. Sanitation was poor and disease was very common. The hospitals were packed full of soldiers, most of whom were lying on the ground. Amputation saws were not cleaned from person to person, and there were no antibiotics. Over the course of the war, there were 50,000 amputations. Luckily, anesthesia was used for most of these. There are two main ways of amputation: the fish mouth method or the circular method. The fish mouth method was when the doctor would cut a little piece of the skin from the limb before cutting it off. They would then put the skin over the amputation and sew it. The other way was the circular method, where the doctor would just cut off the limb straight off and bandage it. This was the more common type of amputation that the doctor could even do in dim light. Most of the time before surgery or amputation, the soldier would have a cloth draped over their nose and mouth that was soaked in ether and chloroform. Both of these mixed would make the soldier unconscious most of the time. Sometimes the patient would not be fully unconscious and feel or imagine what was happening to them. What the field medics carried during the Civil War was a little different than what they do now. There were three things a medic always carried: a saw, a jug of whiskey, and morphine. The saw was for none other than amputations. The jug of whiskey was to calm the soldier from the shock of being wounded. And the morphine. Morphine is a drug that is for treating pain. Also, as shown, the medics carried standard medical supplies. Because of the poor sanitation, diseases ran wild during the Civil War. Some of the more common diseases were smallpox, malaria, and pneumonia. All of these diseases were deadly if they were not treated. Pneumonia is a disease where your lungs fill with mucus and you can't breathe. During the Civil War, this was very deadly because the doctors didn't know exactly how to treat it yet. Because of the common diseases, lots of medicine was developed. One of the most common medicines was Dover's powder. This was a mixture of opium and ipecac. This was used to treat pneumonia and bronchitis. Other medicine was called Camel. This was a mercury-based medicine and was very dangerous. During the Civil War, hospitals advanced greatly. At the start of the war, hospitals were where the soldier died. Towards the end of the war, there was a chance of living. Soldiers would lay on the ground during the beginning. However, like the picture shows, the hospitals soon changed. The hospitals were more organized and able to treat the amount of soldiers coming in. Because of the Civil War, hospitals were open to the public and modern public hospitals were born. Because of the Civil War, medicine and hospitals were made better and more efficient.